India continues to battle against the coronavirus as the government, medical experts and community members are working tirelessly to flatten the curve. Although the country is hit by a huge second coronavirus wave, its government has said the pandemic is showing signs of slowing down in some regions. Let's take a look.
India's launch of 2-deoxy-D-glucose, a new anti-COVID drug, brings new ray of hope. The drug, jointly developed by state-run Defence Research and Development Organisation, that is DRDO, and Dr. Reddy's Laboratories Limited, has been approved for emergency use. Clinical trials showed it aided the recovery of hospitalized coronavirus patients and reduced dependence on supplemental oxygen.
और यह ड्रग जिसका ये इजाद हुआ है, यह आशा और उम्मीद की एक नई किरण लेकर आया है। यानी हमारे देश के सामने एक बड़ा से बड़ा चैलेंज आए, तो हमारे वैज्ञानिकों के अंदर वह क्षमता है, वह ताकत है, तो उसका मुकाबला वह कर सकते हैं। और जो यह ड्रग का इजाद किया गया है, मैं समझता हूं कि हमारे देश के वैज्ञानिकों की एक जो साइंटिफिक कैपेबिलिटी है, उसकी भी एक मिसाल है।
With more than 24 million cases and 270,000 deaths, India is now the epicenter of the global pandemic. Though the official count shows new infections subsiding, there are fears that the new, highly infectious B.1.617 variant is running out of control. Indian Prime Minister Narendra Modi said continuous efforts were being made to increase the supply of COVID-19 vaccines on a large scale across the country.
कोरोना के टीके की सप्लाई को बहुत बड़े स्तर पर बढ़ाने के निरंतर प्रयास किए जा रहे हैं। वैक्सीनेशन के लेकर व्यवस्थाओं और प्रक्रियाओं को हेल्थ मिनिस्ट्री लगातार स्ट्रीमलाइन कर रही है। कोशिश ये है कि अगले 15 दिन का शेड्यूल राज्यों को एडवांस में मिल जाए।
India also began a pilot program for Russia's SputnikV COVID-19 vaccine on May 17 to work out supply chain and logistical needs for distribution across the nation. SputnikV is a 2-dose shot that has been found to be 91.6% effective in preventing people from developing coronavirus, a higher efficacy rate than the 2 vaccines currently approved in India. India received 60,000 doses of SputnikV from Russia as part of its second consignment of the vaccine.
We are running the pilot with a few people. By doing so, we will be able to establish the integrity of the supply chain. We will be able to see how the cold chain works. We will be able to see how the logistics work. And by doing this, we will be able to make sure that we have enough learning so that we can scale it up across the country.
Besides government efforts, the people are also joining hands to help the needy. Indian chef and philanthropist Sanjeev Kapoor joined hands with an initiative which provides free lip-smacking delicacies to healthcare staff of various hospitals across cities. Kapoor, in coordination with luxury hotels chain Taj and a social welfare group World Central Kitchen, is providing about 17,000 meals daily to hospitals in over a half a dozen cities across the country.
काफ़ी सिटीज़ के अंदर अब करीब 17,000 से ज़्यादा डेली मील्स सप्लाई किए जा रहे हैं, फ्री एकदम, जिसमें डॉक्टर्स हैं, नर्सेज हैं, वार्ड बॉयज़ हैं, क्लीनर्स हैं, उन सबको खाना दिया जा रहा है। आइडिया ये है कि क्योंकि इस समय जो हमारी मेडिकल फ्रेटर्निटी है वो काफ़ी स्ट्रेस्ड है, और उनको मोटिवेट करने के लिए खाने के माध्यम से हम मोटिवेट करना चाहते हैं। ऐसा नहीं कि वो पहले से खाना उनको नहीं मिलता था, लेकिन खाने से थोड़ी सी मुस्कुराहट आ सके।
As India's COVID-19 crisis continues to overwhelm the country's healthcare system, informal groups of volunteers have sprung up, working to locate care beds, critical stocks, and volunteering as ambulance drivers. Brothers Murtaza Junaid and Mutib Zoheb are part of a growing number of informal volunteers and volunteer groups across India. The pair responds to hundreds of calls every week, from transferring patients to picking up dead bodies. Volunteers like them are particularly cropping up in smaller towns as the pandemic death toll spreads beyond urban centers.